Thank you very much for you join. Mr. Chu understood that this itinerary only 5. The first welcoming speech from me, short only 2 minutes, and then the second is ASEAN Lecture Community official video by Gumilang as the host, and the third, the first speaker, Nurse Swarsa Dewi, Master Nursing, and then is the director of Nursing College of Fatmawati, Jakarta. And the second speaker is Associate Prof. Dr. Chu Heng Hai, School of Physiotherapy, IIMS Malaysia. And then the last, Dr. Zeliza Muta Azra, Master of Nutrition. Di sini disebut gizi ya, lecturer Esa Unggul University Jakarta. Okay, ladies and gentlemen, and proudly of the participant from Jakarta, from Surabaya, from Kediri, East Java, from Bekasi City, from Malaysia, certain Thai, and then I think from Malaysia must be. Therefore, let's start this event today with the prayer first. Praise, please. Bismillah. Thank you very much. The second agenda is welcoming speech once more. Nice to meet you and very thank for Associate Prof. Dr. Chu Heng Hai from IIMS University, Nurse Swarsa Dewi, Master of Nursing from College University Nursing Fatmawati, and Dr. Zeliza Mutia from Esa Unggul University. Let's look the ASEAN Lecture Communities videos by Indah Gumilang. Swarsa Dewi, Master Nursing, is the first speaker. Time, as you know, around 25 to 40 minutes. Bu, silah. Selamat datang Ibu Wahyu dan lain-lain. Okay.
Okay, thank you, the Honorable Professor
Welcome.
Rizal and the Associate Professor Dr. Chu and Dr. Mutia and all the audience have already attended here. Thank you so much. And of course, I would like to say nice to meet you all because we are maybe a long time is not meet you. So now is my chance to present about the spine injury. Okay, so from Dr. Chu, we have already 4 years cooperation. Maybe for the next, I will continue not only in sharing lecture, but I would like to share in publication or sharing in research. So right now we have the same topic. We hope for the next we can collaboration in research. Okay, thank you so much. I will start right now. So I would like to share our slide. Okay.
Okay. Your
Okay.
screen right now is clear.
Okay, everybody, can you see my slides?
Yeah, clear. Yeah, clear.
Everybody,
Very
can you
good.
see? Clear. Okay, thank you so much. Okay, here I would like to discuss and I would like to explain about how important the exercise right now is very trendy, not only for healthy people, but for the patient too, for anyone, everyone, because for increasing the energy, increasing the our power, we have to have a strong bone and muscle and then and joint. So right now I just want to share in patient with spinal cord injury. Yeah, and I would like to what is the role of the nurse in caring patients spinal cord injury. Here is our topic is exercise complementary therapy as prescription for prevent contracture on spinal cord injury patient. Overview for introduction spinal cord injury and impact of spinal cord injury, management therapy and nursing care. Conclusion. So here I would like to share to you all that according to the National Spinal Cord Injury Associated as many as 400, 4,000, 50,000 people in the United States living with spinal cord injury. Every year, estimate 17,000 new spinal cord injury occur in the United States. Most of that are caused by trauma and in the vertebral. So affecting in the spinal cord stabilization, send and receive a messenger from the brain and the body system that's control sensory, motoric, and autonomic function below level of injury. Okay, define of spinal cord injury. What is the meaning of spinal cord injury? Spinal cord injury is damage of the Tate bundle cell in the nerve that send and receive signal from the brain. Spinal cord injury can be caused by direct injury to the spine cord itself or from the damage to tissue and bones, vertebrae that surround the spinal cord. This damage can result temporary or permanent change in the sensation, movement, strength, and body function below the site of injury. Some injury that cause lethal or self-death may allow for the almost complete recovery, while those that occur higher and spinal cord and are more serious can cause paralysis and most the body. So, what is the cause of spinal cord injury? The most motor physical accident are leading cause spinal cord injury in United States younger individual. Fall are the leading cause for spinal cord injury people over 65. So for people when more than 60 must be aware prevention fall because will be occur spinal cord injury. Just over half all spinal cord injury occur in the person aged 16 to 30, most whom are males. Males also represent nearly all 90% sport-related spinal cord injury. It's meaning for the younger men is already occur caused by sport. Okay. Spinal cord injury are graded. Yeah, it's meaning this level. Spinal cord injury not only one type but four type A, B, C, D. A, it's meaning injury is completed spinal cord injury with no sensory or motor function preserved. It's meaning saraf dan otot kehilangan rasa. Ya, it's meaning the patient may be paralysis or paraplegia. Asia B, Asia is meaning American Spinal Injury Association. Asia B, sensory incomplete injury with complete motor function loss. Yeah, this is sensory is still alive, but motor function loss. SSC, motor incomplete injury, where there the some movement but less than half muscle group are anti-gravity and gravity with the full ring motor. Ya, jadi level C di sini incomplete injury, jadi belum sampai ke kanalnya, tetapi sudah menghilangkan kelemahannya, sudah menurunkan kekuatannya, jadi pasiennya lemah. So SAD, motor incomplete injury with more than half the muscle group anti-gravity. Yeah, okay, SNA is normal. Okay, this is the level of injury. If the level until the full, until the canal, there must be level A. So nerve and muscle must be loose all. So a patient cannot move to any place and then cannot do anything. So must be full helpful. Okay. The effect of spinal cord injury depended on. Jadi efek dari spinal cord injury tergantung tergantung grade-nya. Jadi depend on the grade. Person with spinal cord injury above, di atas cervical 4, may require ventilator to breathe. Jadi if the person occur the spinal cord injury in the cervical, so it will affect in the breathing. Yeah. So in the cervical 5 injury, often left shoulder and bicep control, but no control at the wrist or hand. Ya, semakin ke bawah dia akan mengenai sampai tangan, pergelangan tangan. If the cervical 6 injury, left control of wrist, but no the hand. Jadi hanya di jari-jarinya, hanya di pergelangan, tapi tidak di tangan. Ya. So if the cervical 7 until thoracal 1 injury leave the ability to straighten an arm but have only limited hand and finger dexterity, as well as loss of the sensation or motor function, and spinal cord injury produce other things. There can be bowel and bladder dysfunction, and sexual function is also frequent affected. Jadi kalau sampai ke bawahnya lagi akan terjadi kerusakan pada bowel dan bladder and sexual function. So for the people with above 60 must beware of your spine. Okay, very high injury, cervical 1 and 2, resulting in loss of many involuntary function, including the ability to breathe, necessitating breath aid such as mechanical ventilator, diaphragm, pacemaker. So it's meaning if someone occur the injury in the cervical ones, so she couldn't or they couldn't breathe well and they need ventilator. Yeah. At the thoracal one and until it, there is most often control of the hand, but lack of the abdominal muscle control leaves poor trunk control. Ya. Jadi kalau sampai ke thoracal bisa akan mengenai dada dan perut. Ya. Oke. Okay. This is spinal cord injury pasien need length of stay hospitalized. Jadi kalau pasiennya mengalami spinal cord injury, dia membutuhkan perawatan yang jangka panjang. So patient will be immobilization a long time, decrease muscle strength and joint ring, decrease physical function ability, consequently become contracture. This is what must be noted, that a patient long time immobilization and then must be effect of decreased muscle and decrease of physical function, and for a long time, as long as possible, can be contracture. What is the meaning contracture? Okay, I will explain in the other slide. Okay, right now the trend of the complementary therapy is exercise. A lot of researchers have researched about the exercise. It's a very lot of benefit of that. Uh, this is benefit of exercise: increase muscle strength and joint ring, increase endurance, increase quality of life. Of course, it's still a lot of benefit of exercise. Not only that, that's the first can improve the circulation, and then all the system but in body will be improved. So regarding of WHO or World Health Organization statement, everybody, even healthy or not healthy, must be exercised at least 50 minutes every exercise, and then 3 times a week. This is the statement of World Health Organization. This is our spine. We are talking about the cervical. Cervical is available over here, is located over here. If someone occur injured and cervical one, until the canal, it's will be occur the spinal cord injury. So will be influenced in the breathing of the patient, and then 2 until 3 will be influence the work from the heart, and then until and below. So every spine will be influence all of the body. So right now, exercise ring of motion prevent contracture on the spinal cord injury patient. So contractor, what is the meaning of contractor? Limb contractor are common impaired neuromuscular disease, yeah, cause of break in the spine, yeah. So will be influence impair of nerve and muscular. They contribute increase disability due to decreased motor performance, mobility, limitation, and reduced functional ring of motion, loss function for activity daily, and limb contractor is the lack of full passive ring of motion joint, muscle or soft tissue limitation. Contractor in the neuromuscular disease develop due intrinsic myotendineous structure change intrinsic factor. Okay. Management of contractor. Contractors should be managed to minimize the impact of disability. First, prevention contractor require early diagnosis and initiation, physical medicine approach such as passive ring of motion splinting. Contractors are inevitable as some neuromuscular disease condition. Advanced contractor become fixed and show a lethal response to conservative intervention such as stretching, splinting program, and many require surgical intervention. Okay. Condition of the contractor patient. A major lower limb contractor is minimize their adverse effect of independent ambulation. However, the major cause of generally weakness. Static positioning of both upper and lower limb is important cause of contracture formation. Male upper limb contracture may be negatively impact function. So, rehabilitation management of limb contracture, four principal physical therapy modalities must be regularly carried into prevent daily the development of lower limb contracture. First, regular physical provide daily standing and walking or walking. The second, passive ring of motion stretching or muscle joint and positioning in the limb promotes extension and opposite flexion. Splending with the useful measure for the prevention or daily contracture. Minimum 2 to 3 hours daily standing and walking. Necessary addition a passive stretching for control of contracture formation and myopathy and passive stretching. Intensive exercise program can be assessed to improve independent functional ability. Intensive exercise programs such as neuromoves activity-based therapy can assist to improve independent function ability. There are currently no treatment or cure for spinal cord injury. However, international and here Australian researchers are working toward possible treatment. So passive ring of motion, a program passive stretching. Ring of motion should be started as early as possible, become part of regular morning and evening routine. Proper technique is essential passive stretching to be effective. With each stretching, position should be a cone 15 and each exercise should be repeated 10 to 15 times during session. It's meaning a length of exercise 15 minutes and then every step of movement until 10 until 15 repeated. The specific anatomy focused stretching exercise prescribed for lower limb contracture will vary with the type of neuromuscular disease. Lower limb position may be useful junk for preventing contracture formation. The limb should be placed in the resting position that opposes or minimizes flexion. The front laying position is an effective method to stretch the hip flexor. This is one of example stretching, how to stretch a patient when occur the contracture, in limb of below, yeah, like that. Stretch its meaning, so must be stretched, and then how to hold the lower limb like that. Yeah, this is stretch and this is flex. Flexi. How many times? Every movement repeat until 10 to 15. So during 15 minutes. So stretching the treatment, preventing contraction. This is by Lisa Harley Owen Cartledge et al. The publication, the research in 2017. Contractor. So contractor are common complication, neurological and non-neurological condition are characterized by reduction of joint mobility. Stress widely used to treatment prevention contractor. However, it is not clear whether strength in the stretch is effective. This is all I say regarding in evidence, yeah. But the conclusion, both stretching and technique ring of motion exercise are useful to prevent burn contracture, are non-invasive, cost-effective as noted in this study. Stretching is more effective to improving ring of motion at joint, so recommended to use in technique clinically prevention contracture. It's meaning this conclusion, stretching and ring of motion is a very very effective to prevent contracture. Even the patient occur contracture in advance, but at least prevent to widely contracture. Yeah. So conclusion, regularized threats does not produce. One of research say that conclusion, regularized threat does not produce clinically important change, joint mobility, bend and specificity or activity limitation. But most of researchers have already resolved the research. Yeah, it's a very benefit exercise for prevent contractor
Okay.
even to. Okay, okay, I would like to show, this is my experience. Yeah, effectiveness in bed exercise program for preventing elderly lower extremity contractor who are institutionalized in nursing home. Jadi ini hasil result of my research when on 2019 I tried to give 12 I tried to give have given 8-week observation before and after in intervention by ring of motion and stretching. So the result is improved flexibility of joint, and then a patient more increase the independently. This is I have done in the Pondok Indah Margaguna,
Hospital.
not hospital,
Region.
apa panti jompo, ya panti jompo. Ya itu hasilnya. Nah, this is example of how to ring or motion a patient. Yeah, stretching in the shoulder like that. Yeah, and then continue if the stretching in the upper arm. This is stretching. Yeah, if a patient is let them only lie down, so all the muscle will be decreased, and then as long as possible, God's contractor, all will be stiff and rigid, all the body. So like that. How many time we must do? How many time nurse must do the stretching and flexi and ring of motion of patient? Is better every 4 hours, but if not have enough time, it's better recommended 2 times a day, in the morning and in the afternoon before sleeping. Before sleeping. For like this. This is for upper arm. Yeah. This is for the still upper arm, and then okay, this is for the lower limb. Yeah, lower limb. This is why in at the hospital, even in the hospitalized nursing home, is not done. Is haven't done yet because it's a very little health a server, so she cannot do all the activity patient. Yeah. Okay. This is for hand. This is for foot. Yeah. If foot let immobilization a long time, it must be a very rigid this. Yeah, and then couldn't move anymore. Yeah, and then so like this. Not only nurse do, but we have to educated the family of a patient who care every day at the hospital, even in the at home. Yeah. Okay, like that. Thank you very much. Thank you for
Okay,
attention.
very good. A very good
So I'm
presentation,
sorry,
Bu.
maybe it is not complete
No
yet.
problem, but we are, and I am especially get the new experience. Okay,
Okay, for
thank
you.
you, Bu Dewi. Okay, you can
Yeah,
to shut
okay.
down first.
Yeah,
You shut down first
okay.
your screen. We
Yeah.
will to look the video about Bali Island because Mr. Chu Heng Hai do not yet come there. Therefore, Indah Gumilang will be to share
Okay.
the official, will be to share the short video, a song about Bali Islands for Mr. Chu supaya mau datang cepat ke Bali sebab Bali is the best place of tourism
Paradise.
in the world, paradise. Therefore,
Terima
Indah
kasih.
Gumilang will be to share the song by video for the Mr. Chu and Mr. Nava. Look the Bali and the all the participants. Indah Gumilang, are you ready to share before Mr. Chu presentation and the last speaker, Miss JJ or Miss Liza? Indah, where are you? The song about Bali. This is a many song about Bali. Therefore, Indah, I think will be to choose which one, Diana.
Participating in this event. So, in brief, allow me to introduce where I've come from. I'm an adjunct professor, associate professor in this university, and I work under Faculty of Allied Health. And in Faculty of Allied Health, we have physiotherapy, and also we have nursing. For physiotherapy, we have Master of Physiotherapy in Musculoskeletal. So that is brief about university. So it's, you know, the world population is getting older and older. The world will need more nurses and also physiotherapy. We need more nurses and physiotherapy on regular basis, much more compared to doctors. And our health facility, instead of getting more and more complicated and more expensive, I think it should be more simplified and more user-friendly. Then only we can cope this burden of health system. So with this, I would like to start the topic that we want for today is scoliosis. And scoliosis, because it's so common, it's a very common disease associated with disease, aging also. So what is scoliosis?
Scoliosis.
It is sideways bending of the spine. When we call it scoliosis, when the angle is more than 10 degrees, it associates, no, it is can be in C shape or S shape, and usually it associates with some rotation. And when we talk about scoliosis, it is not only the bone. Actually, it has a three component. The bone is malaligned. The muscle is in balance. One side is stronger than the other side. The ligament also in balance. One side is shorter or tighter than the other side. So how do we know a person is scoliosis? Very simple. You just ask him to bend forward and you observe from the back. So that is called bending, Adam bending test. X-ray. When we do X-ray, there is method of measuring this angle. We call Cobb's angle. When the Cobb's angle is beyond 10, we call it is a scoliosis. And it from 10 onward, it's classified to mild, moderate, severe, and a very severe version, which is more than 90. So according to American Academy of Family Physician, this is the recommendation treatment guideline. If it's more, it is 10. If less than 10, we don't call it scoliosis, we call it spinal asymmetry. You see, if it's here, it's less than 20, the treatment is observation. I do not really know what is the therapeutic value of the observation. So I think this is the reason why one of the reasons why we have this session today. We should not ignore. We should start educating knowledge of prevention and simple exercise to prevent from 10 to go further. So we cannot wait for the patient to get more serious, then we can intervene with surgically or medically. So it is not fair to the patient. We should share the knowledge to help them to prevent. So if a person is beyond 20, brace are indicated, and it's beyond 40, surgery are indicated. Brace is structured like this, and it is quite costly. You can see in newspaper, they look for donation for this. In Malaysia, it costs 4,000 to 5,000 per set, and for this, the patient need to have multiple set before it can need to change, keep remolding according to the curvature and keep moving, and so it may need more than one set for that. So, and surgery is implantation of metal. This is in brief. Let us go. How common is that? Generally, it accepted as a 2 to 3% of general population. If Malaysia, we have 30 million, 32 million population, is almost a million in the whole country. So it usually it's more among women, among girls than boys. Usually started in early age, teenage age, as you can see over here. It started in teenage, and it doesn't mean it come down. It stay in the adulthood. This is incident. Prevalence keep increasing as the age progress. And according to a study in Malaysia, when they did a study on the subject 13 to 15 years old, the prevalence is 2.55%. And screening program is recommended throughout the nation. And why we should bother scoliosis? Because it get worsened. It get worsened when the bone is still soft early age, before the bone harden. And also when we are old, we have osteoporosis, it become worsened faster. During the adulthood, it still get worsened, but may not be that fast. As you can see, we understood it is 2 to 3%, but we forgot to include this part. As the age increase, the incident go up to, the prevalence go up to 20 to 30% at the age of 30, 70 to 80. So, and it can also complicate. It complicate to various things, various problem, chronic back pain, low self-esteem, prone to injury, intervertebral disc prolapse. This is I will go in detail about this thing, and it caused a lot of financial problem and cause productivity loss. So as we can see here in this study, showing that 84% of the patient have the disc prolapse happens on the convex side of the scoliosis. And what are the causes of this? There are a lot of causes depending on the sources. There are different categories, and you can see there are multiple causes, but majority of the causes falls into the category of so-called unknown. What is idiopathic? Idiopathic means the cause is unknown. So my question is, if we do not know the cause, how are we going to treat? Scientists try to relate it to gene, and we may think it is because of heavy back. And I don't really agree with that also. If the weight is a problem, and how about this person? The world record for this yoke walk is 555 kilos. His bone also made from calcium and collagen. There is no metal inside. What is the reason for so strong? I think the most important is the posture. You can see these girls, this easily 100 or to 200 kilos, and the most important thing is actually the posture. So what causes scoliosis? Let us see, revisit the science basics, and let us understand how much we can understand what could be the cause mechanism of this. So this is a normal erect spine, and even though officially we think it is idiopathic, but there are multiple factors contributing to that. Posture is number one. and many other factors contributing, including nutrition. Later, one of the speakers will be talking about nutrition. And we know they are more common among girls. And when you say load alone is not sufficient to contribute. The load on the poor posture, on a prolonged duration, and the weight, and so on. So here I made a simple graph. For everything, there is ideal position, ideal limit. And there are certain limits that allowed to stretch. It is within a physiological limit. And there are certain limits that a normal person may not achieve, but a person extraordinary good, they can achieve this extraordinary physiological limit. But there are certain limits that when you go beyond that limit, it started to cause problem to your health. And maybe that problem, if you stop it, it will still come back to normal. And there are a limit for practically everything, beyond which, if you exceed that limit, it will cause you trauma, it causes you damage that you may not reverse back. So I believe it applies to all these factors, and I make the graph to represent this. Take, for example, this one. Our spine, we cannot bend to the back, but because of their demand for the sport, they stretch beyond the physiological limit. Can we call it a pathological? But this is what they want. So, and if you look at them, their bone structure change. They start with stretching the muscle, ligament, and they take times to even change the bone. Then only they can be so flexible. Like what Ibu Devi was telling, our soft tissue will undergo contraction. For them, if they want to maintain the flexibility, they have to keep stretching daily. Otherwise, they will lose the ability to be so flexible. So today, we will try to identify the problem over here. I think we should identify the problem over here so that we do not go beyond the limit to cause problem. So there are three structures that that contribute to scoliosis: muscle, ligament, and bone. When we exercise, our muscle gets stronger, toned up, followed by ligament. After long duration of exercise, even our bone gets stronger. If we do not use, it becomes weaker. Muscle start weak first, ligament, then bone. When we stretch, it becomes elongated, it becomes longer, and even the bone can get longer, but it is very tough, very difficult to stretch. If we do not stretch, it will get shorter, it gets contraction. That's why for those who have spinal injury, the contracture, to prevent contracture, we got to do stretching, passive exercise, at least twice a day. You can see how fast a soft tissue can get shortened or contract. So when we challenge it physically, like boxing, the Thai boxing, they knock the shin become tougher and tougher. When we compress the three tissue, it will decrease the blood supply and it become deformed. This happens as part of physiological changes, and beyond that, it becomes pathological. So based on this theory, this is a very well-established, long-established theory on the growing bone. This is where the growing takes place. So when we compress the growing bone, it will decrease in growing. When we stretch, it will faster in growing. So we have, it's not only in long bone, in every bone, young bone, they have cartilage, and as it go older, it becomes calcified. And once it's the epiphyseal plate is calcified, it cannot grow taller further. But you can, this is example, you can see this gymnasts, they keep jumping and the impact, it compress on the growing bone and it traumatize the growing bone, the compression that prevent them from going taller. For those who have bony, if they don't get corrected, because of the compression, that part, it becomes grow slower than the other part, then the bony get worsened. And dwarf people, they can undergo surgery to fix this external fixator. With this external fixator, gradually, slowly, they screw they tighten the screw to separate the bone apart, and they can gain growth, even though the bone is already mature. So let's come with that understanding, basic understanding. Let us come to the detail about it. See, this is our spine. We can bend to the right or bend to the left. So we can see the bone, the pink color representing the muscle. When the muscle contract, it bend. When the muscle contract on the other side, it bend. So when muscle contract on this side, muscle is contracted, the ligament will be loosened. It becomes shorter and loosened. If you maintain in that position for a longer time, you will get contraction. How about the opposite side? Opposite side relax and get stretched. Because this side contract, the opposite side gets stretched. So if you maintain that in the longer time, example, when you're sitting for a long period of time, when you get up, you become stiff, you start to stretch because the soft tissue get shortened, get contracted quite fast. You see, when a person has tendon cut, they got to repair the tendon immediately. The best is the same day. If they repair the tendon after overnight, tomorrow or day after tomorrow, they can find difficulty to locate the tendon will be recoiled inside. This is because of the contraction. So with that, after prolonged period of in that position, the muscle gets shortened, the ligament gets shortened. This is process of contraction. So, and the weight is bearing on the concave side. The opposite side, because it is stretched and also it is not contracting, it get weakened, the muscle get weakened, the ligament gradually get longer. And as the weight, as the curvature is more toward that side, the weight will be more on that side. It compress. The compression will devitalize or decrease the circulation, and the bone will grow slower than opposite side. And the disc get compressed on the side. And the opposite side, it bulge. A day will come, it may have disc prolapse. So if you look at this X-ray, the concave on this side, the disc will prolapse on this side. But if you see this, on this side, the bone become bone spur, becomes a new growth bone. So when we are straight, the center of gravity pass through the bone, which is healthy, it is the strongest. When we bend, it bear weight, the central gravity go to the one side, and its tendency to push the disc out from the other side. It causes disc prolapse. But if you look at that, it is not only the bulging side that has problem, this side also have problem. Both sides can compress the nerve. When the disc is prolapsed, definitely it can compress on the nerve. But when on the side of concave, where it bear more weight, you go closer to it, the side where bear more weight, the immediate side that has bear extra weight, the zone, the tissue start to die off. Adjacent to that, because of this pressure, it get injury. The injury will give response to healing. Our body try to heal. So as a result of healing, the new bone tissue grow. But because of pressure from the bottom, the dead zone collapse. And what we can see, the bone grow sideways. And now a new area get compressed and the dead zone is represented by this black color. And again, it get compressed, it get lower and lower on this side. And at the same time, it grow, become a sharp bone like this. So this graphic explanation is made by me. Hopefully it helps you to understand easier. So you can see here, even the nerve get compressed, not only on the convex side, it could also get compressed on the concave side because of the bone spur. So if we look at the cause, we have multiple complicated scientific name for that. If we translate it to things that we can understand, it is either muscle, bone, or ligament. And ultimately, when it is long-term, it involves everyone. It's involved muscle, ligament, and bone. You can say they may be neurological, congenital, because congenital defect of the bone. The bone causes scoliosis. And they may be neurological, there's like cerebral palsy, the nerve. Because of the nerve affected, the muscle cannot perform. That's why the muscle cannot become not balanced. And ultimately, it may also lead to the muscle or bone changes. So the other thing is I would like to highlight why girls has more. I think it is related to the posture. In this picture, can you identify which one is scoliosis, which one is scoliotic? No, they look sexy. So because the posture that they maintain, we get used to that. If that, I think that is a reason. At one time, I was invited to talk on pelvic floor in an international conference, and the one scientist was talking on scoliosis, and she was trying to find. She was sharing the genetic evidence of why women has more scoliosis. I asked her, can this posture itself be the main factor for the scoliosis? And she agreed with me. So by maintaining in this posture, the side that in the concave side is undergoing contraction, the convex side undergoing stretching, and the bone on the concave side undergoing compression that slow down the growth, and the bone on the opposite side has more space to grow. And that explains how posture can lead to scoliosis. So my question is, can we think posture is the main factor? My answer is yes. If you look at this picture, the girl is sexy looking because of the curvature. After certain decades, we know the age increase, osteoporosis increase, and this is the patient come to my clinic. This one I don't call it sexy, it's sexa for her. She is painful, she is difficult to walk, she had difficulty to sit, in even nighttime having pain. So what are the other contributing factors? How we carry our weights. Here is definitely one of the reasons why women has more scoliosis, because carry baby on the hip. And this may be light, but we tend to carry on the same side. That posture, the habit of carrying on the same side, help us to maintain a curvy posture. That contribute to scoliosis. Men may have scoliosis. One of the reasons they like to put wallet at the back. And men carry weights on the shoulder, and if you carry weights on your right shoulder, you tend to carry on the right shoulder only. When the person cannot carry weight on the opposite shoulder. So how to correct this thing? So first, we do no harm. We remove all the contributing factors. Just now we know all these contributing factors. Remove all those contributing factors. And based on this understanding, compression and traction is sufficient for us to formulate our treatment. You can see the bone can be lengthened, and see the malalignment of the teeth can be adjusted. The bone and the teeth are so strongly bound together, and we adjust it. How? Is it because of the same, this theory, this Hutter-Walkman theory. See, when the teeth is pushed on constantly from one direction, in one direction, this side, the bone undergo compression, this side, the bone undergo traction. And this gradually, this grows slower and this grows faster and it shifts. So it's very simple, the basic simple. We just use a rubber band and it keeps changing the position. It's just like how we mold a bonsai tree. If you want to straighten the bonsai tree, also can. Only with the wire also, but you need time to gradually to straighten it back. So now the problem is like this. So how can we correct? Just now, we have the disease, we have the problem because of our poor posture, because we contract the side, this side more than this side. Now, we have to just contract on the opposite side. We exercise the muscle only on the convex side. So by strengthening the convex side muscle, the muscle gets stronger and it pulls the ligament gradually undergo contracture, it becomes shorter. And on the opposite side, what we need is keep stretching the concave side. So by stretching, it becomes elongated. It's just like a passive exercise. We stretch on the concave side to prevent contraction. And beyond that, we stretch it, get it longer. So by doing that, before it go beyond it, certain pathological limit, I think we can reverse it back. By stretching, by pulling this side, the blood circulation improves. This side, the blood circulation is compromised. So just reverse the whole process. And before it damage, I think we should be able to bring it back. It's just like how we have successfully performed for orthodontic, for the malalignment of the teeth, and also how we correct, how we mold, how we change our bonsai tree. In the market, there are multiple methods of treatment for scoliosis. Start from physiotherapy, Scott method, chiropractic, yoga, braces, surgery, and so on. If you look at this, the intervention is the same, muscle, ligament, or bone. So we can see physiotherapy are playing with muscle and ligament, Scott method, muscle, ligament, yoga, muscle, ligament, braces also muscle and ligament. If all those fail, surgeon will intervene by operating on the bone or the disc. So this is a stretching of whatever type it is stretching. It stretches the concave side, muscle and ligament. This is also a form of stretching. And this device I saw in the internet is made by American. Is about 25,000 Malaysian ringgit. It is 5,000 USD. I do not know how much it will be in rupee. And this is the home exercise that we can do. This on the right is my mom. She has a lumbar scoliosis also. So I think this is a very cheap method that we can do at home. And this is Scott method. It's also stretching the muscle and ligament. These are the stretching using rubber band. What is that about? It is about muscle and ligament also. So I have made some metal model, but I do not have it with me now. So, and this is some of the exercise that physiotherapy use. A person have curvature like this. We put a towel here. The aim, the purpose is to stretch this part, hook to relax this part. So, but if this part is not the muscle doesn't get stronger, it will not hold. So there are exercise. There are various forms of exercise in physiotherapy. This is one of the commonest one. The bird dog exercise is meant for strengthening the muscle by the side of the spine. Step one, you raise left hand, right leg. Then you alternate with left leg and right hand. So you can exercise, you can build the muscle as well. You can see here, these people, they have built the muscle so strong, so prominent, but the spine is still bent. the strength is so strong, they can bend metal rod, but they cannot straighten their bone. What happened? It's because this muscle is not correct enough. It's not accurate enough to fix the problem. It is not every exercise will help everyone. We have to understand which part of the muscle has to be strengthened to balance the unbalance. To balance the unbalance, we have to have exercise which is not balanced. So there are multiple type of exercise. There are braces. They are also on the ligament and muscle. And this is a surgery. So it will cost us 1 car in Malaysia. In Malaysia, it costs 80,000. And imagine if complication, it may cost even 100,000 or more. And this is an advanced surgery. This is, I think it's not available in most of the part of the world. It has one side flexible. You place in screw and then you put a cable inside. So it limits movement on this side. So a person can bend one side, but not to opposite side. Let us see. Let me share with you research we have done in AIMS University. You can see this is a scoliosis. This person has a scoliosis. So what we want is to contract this muscle more so that it will pull. It just act like a rubber band for orthodontic patient. So we have to strengthen this muscle. So we use EMG to detect the muscle contraction. The red pad on the left side and the green pad on the right side. So taking this bird dog exercise therapy, normally physiotherapy will recommend both sides. You do 10 times this side or 10 times opposite side, you keep doing, and you will strengthen both the muscle. I think to correct for a healthy spine, I think it's good. But for a person who has already imbalanced the scoliosis, we need to focus on one side. We need this side to be contract more. Let us see which exercise actually serve the purpose. So when he do right hand up, left leg up, we can see the red one is not contracting more than the green one. In fact, this will worsen the scoliosis. But when we do opposite one, left hand up, right leg up, you can see this is what we want. We want the left side to contract more. This serves the purpose. So this is example. There are many more examples of exercise. We just keep doing both sides. So, but one more thing is when he straighten up, he will have the contracting on the convex side too. So if we can implement the knowledge into our daily activity, when we carry our bag and we do our routine work, when we stand, I think scoliosis will gradually go off. Imagine if you have money, you go to physiotherapy every day 1 hour, but how about the 23 hours at home? If you don't do, which one will win? 23 hours will win or the 1 hour will win? So no matter what is those, you may have different type of scoliosis, and not every exercise are beneficial to a specific patient. Exercise has to be tailored to the patient. So in conclusion, conservative physiotherapy management is not effective. It's not likely to be due to the following: not properly targeted, lack of patient involvement, and lack of compliance. So imply effective physiotherapy solution should have the following criteria. Awareness, knowledge of the patient is very important. We have to be targeted on the side, and it should be objective. We can measure, we can see the progress. Then only we can encourage the patient, also motivate the physiotherapist. Patient involvement is very important. Physiotherapist guidance is very important to supervise the patient, to make sure the patient is always correct along the path of the treatment. If let's say they do the exercise which is good for the first 3 months may not be good when it is getting better. So we have to keep reviewing by physiotherapists and keep improving. And ultimately, the patient compliance is important, not only during compliance to the follow-up, but has to be compliance at home. So other important take-home message is physiotherapy correction need times. We have to understand it's not like you go there for 2-3 therapy or 1 or 2 weeks therapy, you get corrected. The bone need times. It's just like orthodontic for your teeth malalignment. We give the dentist 1 or 2 years time or 3 years time to correct it. Why? For the backbone, we give physiotherapy only 2 weeks. We go 2 weeks and the physiotherapy can't help you. No way, this physiotherapy is not working. I'm going to other thing. I'm going to traditional massage. I'm going to chiropractic. I'm trying this, that, trying that. A lot of people are wasting money on that. Need guidance of physiotherapy to ensure the effort done beneficiary for your scoliosis. Recommended exercise likely to differ from patient to patient. Recommended exercise for a patient may differ from time to time for the different stages of recovery, and compliance of patient is a vital for optimum recovery. So take home message is meanwhile, these two are the safest that you can do. Stretching by hanging and vertical upward stretching. And this is an example. This x-ray is my mom x-ray. She has a scoliosis of the lumbar, and this started to pinch on the nerve and she caused pain. Orthopedic surgeon asked her, you have to go for surgery. And she told me, and she's willing to take my exercise. I worried. But she said, why you worried? If the thing doesn't go well, go for surgery. And she was very faithfully doing the exercise which I gave. Per day, 2-3 times, you can see. February 2nd, this is March 10. I was shocked. You can see this x-ray. Short period. I think one factor is because of osteoporosis, the bone is soft. The bone is soft, is easy to get worsened, and also it should be easy to get corrected if you apply a proper exercise. So we in AIMS University, we're doing research, we are exploring this, and we looking forward to conduct public workshop to benefit more people. And before that, I would like to share with you, sit properly. Your sitting is a physiotherapy for you. And stand properly. And be careful when you carry weight. When you carry weight, your spine has to be straightened. Don't hang your body load or weight onto the structure on your bone, but instead using your muscle to straighten your skeleton to carry the weight. So remember, your posture is very important. And with that, thank you very much. Remember, prevention is better than cure. Conservative first, invasive last. That is the reason why my area of research, our physiotherapy department of AIMS University, our research priority is to solve medical problem conservatively. If you want to know further information of my other research, you can Google here, www.medicalmadesimple.org. Thank you.
Right. Oh, very interesting relation.
Shahreza. May I share my screen?
Yeah, you are the co-host right now.
Okay.
Very clear with the blue and white.
Okay. Okay, wait a moment. No. Okay, good day, ladies and gentlemen. The Honorable Association Professor Teuku Shahreza, the Honorable Association Professor Dr. Chu Heng Hai, and the Honorable Bu Suarso Dewi, and also the committee and participant in this event. My name is Jeliza Mutia Azra. You can call me JJ or Jeliza. I'm from Universitas Esa Unggul, Jakarta, Indonesia. It's such an honor for me to present about nutritional intake and bone health. Okay.
Right.
Yeah, the nutritional intake and bone health, especially for osteoporosis. Yeah. Such I know, osteoporosis is a silent but a progressive disease affecting the density and quality of bone while greatly increasing fracture risk. Globally, around 1 in 3 women and 1 in 5 men are risk of an osteoporotic fracture, with the most common fracture being at the hip, spine, or wrist. And the pathogenesis of osteoporosis is multifaceted, consisting between physiological processes, including hormonal status, along with genetic and also environmental factors. Osteoporosis is associated with substantial morbidity, increased mortality, and also impaired quality of life. And recommended general measures for fragility fracture prevention or osteoporosis prevention include a balanced diet with an optimal protein and calcium intake and vitamin D sufficiency. Together, this balanced diet with regular weight-bearing physical exercise. And in this section, we will discuss the role of nutrients and food in maintaining bone health. Okay, we start with the several nutrient content that promote the whole health bone, such as calcium, phosphorus, potassium, vitamin D, and also proteins in several products, such as whole fat milk, skim milk, cheddar cheese, yogurt, and etc. And we start it one by one. First, with the nutrient and bone from calcium. So calcium plays major roles in the regulation skeletal and smooth muscle. The best way to achieve adequate calcium intake is through adhering to healthy diet. The most important sources of calcium in the diet are dairy products, such as in this table, such as milk, yogurt, and cheese, and so also in fish, especially sardine with bones, and also in few vegetable and fruits, particularly nuts and seeds. And the absorption of calcium is generally increased when the calcium is well solubilized and is inhibited when the presence of the agent that binds calcium or form insoluble calcium salts. So calcium supplementation had a positive effect on the whole body bone mineral content, or BMC, and also bone mineral density, or BMD, in the upper extremities. And how much calcium do we need? According to the RDA recommendation, dietary allowance, the calcium intake about 800 until 1,200 milligram per day. Adequate dietary intake of calcium is necessary to replenish the compulsory daily calcium losses. But low calcium intake might compromise bone health by increasing bone remodeling through secondary hyperparathyroidism. Okay, the next one is magnesium. Magnesium is a cation cofactor for an array of enzymatic reaction and plays a role in PTH secretion in potassium homeostasis or parathyroid hormone, PTH secretion. The recommendation intake in adults is about 420 milligram per day in men and also 320 milligram per day in women. The main dietary sources of magnesium, such as nuts, leafy greens, vegetable, and also dairy products. According to the several publications, a lower magnesium intake was associated with a lower hip bone mineral density or BMD. In contrast, a higher magnesium intake, slightly higher than RDA or recommended dietary allowance, was associated with hazard ratio or higher risk of wrist fracture than normal. Okay, the next nutrient is phosphorus. An adequate phosphorus supply is required for cartilage and also osteoid tissue mineralization. Phosphorus is usually found in high amount in protein-containing foods, such as dairy products, and also in meat, and also in grains, beans, lentils, and nuts. And food additives are also notable source of phosphorus. And from RDA or recommended dietitian allowance suggests that the consumption of phosphorus is about 700 milligram per day for adults and also 1,250 milligram per day for adolescents during growth. And in under normal conditions, the absorption of phosphorus is in intestine about 60 until 70% of dietary phosphorus. And high dietary phosphorus associated with low calcium intake that leads to increased PTH concentration. So if phosphorus consumed more greater than calcium, it will be potentially linked with bone loss. Okay, the next nutrient is protein. Protein intake influences the production of insulin-like growth hormone factor or IGF-1, the important tropic hormone with growth promoting effect on almost every cell in body, especially in skeletal muscle, cartilage, and also in bone. And in addition, IGF-1 regulates phosphate reabsorption in the kidney and stimulates the active uptake of calcium and phosphate from intestine by stimulating the renal synthesis of calcitriol, the active form of vitamin D. And protein represent approximately about 30% of bone mass. Bone metabolism dependent on the dietary protein intake. And protein intake variation between approximately 0.8 body weight kilogram per kilogram body weight per day until 1.2 gram per kilogram body weight per day, and thus more than RDA recommendation about 0.8 body weight per day. From the meta-analysis had no adverse effect of bone. The next one is vitamins. There are several vitamins related to So for by vitamin A refers to a group of biologically active fat-soluble retinoid metabolites, including retinol. And vitamin A also plays an essential role in maintaining visions, body growth, immune function, and also reproductive health. So from the publication, meta-analysis indicate that higher intake of dietary vitamin A might increase the risk of hip fracture, even though vitamin A is related to bone health. Okay, the next one is vitamin B12. Vitamin B12 can reduce fracture risk or bone turnover, and also reduce fracture incidence in the group older than 80 years in several research. But deficiency of vitamin B12 associated with reduced bone development and also the maintenance of bone. Okay, the other vitamins is vitamin C. The vitamin C in several studies suggests that the influence of vitamin C on bone metabolism, that it can inhibit the osteoclast activity through its antioxidant effect to an increase in type 1 collagen synthesis by osteoblasts. So it's increase the osteoblast, but decrease the osteoclast. So vitamin C can increase intake linked with increased bone density. So the next vitamin is vitamin D. Vitamin D, the active vitamin D metabolite, calcitriol, can increase the intestinal absorption of calcium and phosphate. And dietary sources of vitamin D include fish, smaller amount in eggs and also in meats, fortified foods, and also in dietary supplements. And vitamin D can increase the intestinal absorption of calcium and phosphate and promote the bone mineralization. And the last vitamin is vitamin K. Vitamin K, low intake of vitamin K was associated with higher risk of a hip fracture, but it is association with a low bone mineral density has not been shown in observational studies. So this is the figure about the nutrient intake and its relevant physiological responses to bone health. From this figure, we can see that several nutrients such as oxalic acid, phytic acid, and also dietary fiber. And also, if they bind with calcium, can inhibit the intestinal calcium absorption. Yeah, it can inhibit the intestinal calcium absorption because oxalic acid found in spinach, beets, and celery can bind to calcium and form an insoluble complex that is excreted in feces. And about the phytic acid that found in whole grains, nut, and legume can bind into calcium to form an insoluble complex also, and decreasing the absorption of the calcium. And what about the dietary fiber? Dietary fiber or fiber intake also stimulates the proliferation of friendly bacteria in gut, which bind calcium and make it less available of absorption. And certainly type of dietary fiber, like found in wheat and oat bran, may interfere with calcium absorption by decreasing transit time, limiting the amount of time during digestion for calcium to be absorbed. Okay, so it can inhibit the intestinal calcium absorption. Okay, from the other nutrients such as sodium intake, it can increase the urinary calcium excretion by bone resorption. But in protein intake, it can promote the insulin-like growth factor 1 or IGF-1 to bone deformation. So vitamin D accelerates the absorption of calcium from the gastrointestinal tract, and high consumption of potassium reduces the urinary excretion of calcium. Okay. The dairy product also a source of both protein and calcium that can promote the bone health because it contains a lot of nutrients such as calcium, prebiotics, probiotics, and also the protein. So in higher amount of calcium in fermented milk product can promote the increasing calcium absorption, decreasing the parathyroid hormone, and also increasing the bone mineralization. It can also decreasing the bone resorption. The prebiotic in fermented milk products can increase the fermentation sites and also increase the intestinal permeability modulation that affects the calcium absorption. And the probiotics from the good microbiota modulation can affect the estrogen-like effects and give some stimulation to immune modulation. And the last by promote IGF-1, it can also increase the bone formulation by promote the osteoblast then osteoclast. Okay, maybe that's all from my presentation. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. JJ or Dr. Lisa, for your presentation. For me, it's the new knowledge because I am not from the health sciences. It's okay. Now we will go to questions in my email, and then there is the question in the chat box too for Bu Dewi and Mr. Chu. Now I read the question first for Bu Dewi. Bu Dewi, are you copy me? I will to read the question in my email. From Lani. Ibu Dewi, are you copy me, right? Kang Indah, suara saya boleh dengar tak?
Boleh, Pak.
Okay. Ibu Dewi, very interesting presentation. Thanks. I get the new knowledge from you. From Lani. There is my neighbor trauma after leave from hospital. How the best management after leave from hospital to grow recovery regard his foot. This is the regarding in injury. The second, what is the most important thing when we suspect spinal injury? This is the two questions in my email for you, and you can to answer the one question more in the chat box. And then for Mr. Yu from Yanti, some of citizen afraid to go the hospital if scoliosis regard their children. Is there better medical operation than children to be adults? This is the first. And the second, what is the difference between idiopathic scoliosis and other type of scoliosis, like this congenital and neuromuscular? This is difficult for me. What this? Okay. And then for Dr. Zizi or Saliza is the question from Puspa. I get information that osteoporosis relation nutrition this is consumer less calcium, less sport exercise, smoking, caffeine, and so on. What the best way the recovery of our healthy regarding normal nutrition? Is there nutrition consumption only? Or better with the exercise too? But how about if the someone osteoporosis patient? And the second, is it a consumption of coffee and in post-sport drink better to grow on fertility? How about the key vitamin for the fertility? This is very not familiar with me about the new I mean the name of the nursing I mean spelling that. Okay, Ibu Dewi, you can to answer two questions with my email and one question in the chat box. Please around 5 minutes or 7 minutes you can to answer, please. You are mute, Please unmute for the question.
Okay. In
Yeah, please.
the second question,
Yeah.
I'm not complete yet to hear that what is the best minutes for spine?
What is the most this is what is the most important thing when we suspect a spinal injury?
The most important thing. Okay. So the first trauma his foot. What should
Yeah.
trauma his foot? Okay. Okay, thank you for your question. It is a good question, I think. But my explanation talking about the preventing of contracture. But I try to explain that is your question is about the fracture. Yeah, if someone got a fracture, the first you have a management of fracture. We have using 4R. First, recognize in which body get fracture, yeah, and then the second reposition. So the third is immobilization, and the fourth is rehabilitation. All in the first, how to know that she or he gets a fracture by looking which one maybe swollen, maybe red, maybe and then moving like if feel pain, this is a fracture. And then if the listing like the bone is shown, this is a fracture. And first action must be go to X-ray. Yeah, go to X-ray radiology, and then the doctor will determine that's that operation or not. Yeah. After that, if after getting operation, and then must be immobilization. So during mobilization, as soon as possible, must immobilization as soon as possible, must step by step mobilization by exercise ring of motion and then stretching to like that, yeah. And then the second, if the someone suspect spine, yeah, what the most important for the spine, yeah, we have to know in location of the spine. As is different location and different grade, as is different sign. How to know if someone getting a spine in the cervical? Cervical is the most important breathing. Yeah. So someone couldn't. If we ask something, she couldn't answer that, and then she will faint very much, and then look like the exposure around the neck if getting a trauma or getting accident. So the second one, of course, we couldn't determine what should I do. Just getting the spines or supine position, and then without mobile, because it is a very important for spine. If the mobile will be get dislocation, so consult as soon as possible to a doctor. Yeah, we just talking about what should I do as a family, consulting to the doctor, and don't moving around, don't moving by yourself. This is very danger for you.
Yeah.
But
Yeah.
if just only fin middle or meals fin, it is not, maybe not to emergency like that.
Okay. Okay. There is one question in the
Thank
chat box. You can to respond
chat box. Okay.
from Nursing Jalan Kimia.
Oh, problem. Okay. Oh yeah. Okay. From Akbar Jain Kimia. What about complaint with post of patient with complaint not free to active patient with complaint pain when they are whole?
Include in your answer before.
No, wait a second. About complaint with post-operation patient with complaint not free to activity, but patient who complain pain when they are school, air, the air is cold. Yeah, of course, if the air is cold, must be turn off the air condition or higher the temperature because maybe couldn't stand with the cool weather. Yeah. So a fan, the first collaboration with a doctor, and the second, we just try to distraction the fan with deep breathing like that. This is a role of nurse. Yeah.
Okay.
Okay, I
Okay.
think it's enough. Thank you
Okay,
very
thank
much.
you very much. And the second answer from Mr. Chu, please.
Yeah.
There is the question in chat box too, and 2 questions from my email.
Okay. So the question in the chat box, I think I answered the question in chat box. The question in chat box is like this. So is these braces is effective for those obese person with scoliosis? I think the answer is it is very ineffective for those who are obese. It's just like when you have in banana satu tandan pisang yang masak, kita nak pegang tu, kita kena pegang batang tengah dia. Kalau kita pegang buah dia sudah hancur kalau dia masak. Jadi so imagine when a person who obese jumping, the bone is going different direction and the fat is going different direction. So there is no bonding. So when you hold on this fat on the skin, how can we expect the bone can change shape? So I think that answer, I think with obesity, the scoliosis, that we cannot, depending on the holding of the structure on the skin, on the fat. So what we can do is exercise the muscle, because the muscle is the one that next to the spine. We can control the muscle. Muscle is voluntary. It's controlled by our voluntary movement. So we can train the muscle. When the muscle becomes stronger, it just acts like a rubber band for the orthodontic doctor. So I hope that answered my question. So the next question is, Prof, can you remind me again the question?
Next question dia tanya, what the difference between idiopathic scoliosis?
Different between, okay. So idiopathic and whatever name you have, musculoskeletal, there are so many category of naming it, different category way of categorize it. Some they name it by the age, that mean infantile, adult or elderly, go by age. Some they name it by the name of the disease, spinal bifida, whatever. So idiopathic is the biggest group. Musculoskeletal is just blaming is because of the musculoskeletal. Is a general term. Scoliosis itself is a musculoskeletal problem. So idiopathic is a group that they call it because they don't know the cause. So anything that they do not know the cause, they put under idiopathic. And that means idiopathic group is they do not have clear other diagnosis associated with that. Some of the scoliosis, they may have congenital problem. Congenital means when you are born, you have already certain defect. That defect contribute to your scoliosis. So then we blame that scoliosis as a congenital problem. And most of the scoliosis, you are born normal, but you become scoliosis after that. And those groups are called as idiopathic. Idiopathic, the meaning of idiopathic is no cause for that. So I think we cannot say it's idiopathic, and we say idiopathic, we do not know the cause, and how are we going to treat? So just now the presentation, I'm trying to explain what is the mechanism of the scoliosis, for the scoliosis to happen. So I think by understanding the mechanism, we just do the opposite so that it can treat this patient.
Okay, good. Very smart answer. And don't forget, you come to Jakarta and Bali to Bu Dewi after Dr. JJ answer. Okay, Bu.
Okay, welcome.
Okay,
I will
Dr.
come.
JJ will be to answer the two questions
Welcome,
for
Dr.
you.
Chu.
Hmm.
Not only me go to Malaysia.
Okay,
Yeah,
Dr.
we
JJ.
should work together.
Okay, right now
Okay.
Dr. JJ will be to answer the question.
Okay, thank you, Prof. Teguh Syahreza. Maybe I wanna answer the first question. Yeah, in osteoporosis, rising numbers of people consuming nutrient-pure diets, coupled with aging population and sedentary lifestyle, appear to the main drivers behind this. And until recently, the calcium and vitamin D were regarded as the main nutrients essential to bone health. But now, our emerging role of several micronutrients such as phosphorus, magnesium, selenium, and the others, and also from the vitamin, including vitamin K. And but in osteoporosis patients, fruits and vegetables are still not being eaten in adequate amount and yet containing micronutrients and phytochemicals useful for bone remodeling. So in osteoporosis patient, or if we want to prevent the osteoporosis, we also should to consumption fruit and vegetable adequately, because it's also essential for reducing inflammation and oxidative stress. So what is the best diet? The recommendation is a balanced diet containing food groups and nutrients needed for bone health. All the nutrients for bone health and also whole life cycle may help to prevent osteoporosis. And also by physical activity modifications, we also need to do exercise, because exercise, one of the benefit from exercise is can help to give a pressure from the muscle to the bone to make the bone more compact and also make it more strong. Like
Increase
that.
density.
Okay, thank you. Very good. Okay, now
Bone
there
density.
is 3 minutes more for the closing before we will to sharing the